January 20th, 2026. I'm Dr. Deukmedjian. Welcome to Deuk Spine Institute. Our patient has thoracic pain, thoracic spine pain to be specific. It's right off the center of his spine on both sides. It runs from about T4 down to T7, stapler. And he's here for several reasons. One of them is his thoracic facet joint pain, which is we're about to treat right now with our Deuk plasma rhizotomy. Henry,
Yes,
let's
sir.
show the audience how facet joints get injured and end up causing chronic back pain in the thoracic region.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And welcome back. So you can see from our video that thoracic pain from a facet joint actually comes from inflammation that's happening in the joint, specifically the capsule of the joint. Now, what happens is we get a traumatic injury to our spine. It literally rips the capsule wide open, and your body then tries to heal the capsule through a process called inflammation. However, the inflammation sometimes doesn't work at fixing capsules because the movement is still occurring. Does that make sense? The movement is still occurring. So 1, 2, 3, 4. And as long as that movement is occurring, you're going to never be able to heal that capsule. Shot? All right, I've got to find my way to the target, which is the place where the transverse process meets with the pedicle. Shot? That's looking pretty good. Can we clean up that collimator? All right, there's one. I want to get the one above 2. We have to use an X-ray machine, folks, because you can't see the anatomy with your eyes. It's buried under muscles and soft tissues. So to be able to target where the pain nerves are, I use an AP X-ray. AP is anterior posterior. And I got to basically look for where the pedicle is. And Jordan, show us the pedicle. That's right, that's the circle. And just to the side of the pedicle is where the pain nerve runs. And that's where I have to target. Is just to the side of that pedicle. Okay? Any questions from our audience? Shot?
At this moment, no current questions.
You guys see the position there? That is the perfect spot.
Yes, we
literally.
do.
Right there. That's where the pain nerve runs, and I just cut it. That's 2 pain nerves down, and we're going to go after the rest. Go ahead, Henry. What were you going to say?
I was saying there's no current questions, so in the meantime, why don't we show the audience of how
Sure.
it is that we
Sean.
cure facetogenic thoracic
I love it.
back
Let's
pain.
do that.
Facet joint injury is a common cause of chronic thoracic back pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. inflamed facet joint pain nerves are destroyed. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. We are just destroying the last pain nerve on his left side. And I'm going to move over to the right side next. Sean? Alrighty. I'm sorry? Yeah, thanks. Any questions from our audience?
At this moment, no current questions.
So, folks, so far we've treated the facets on the left side from T4 to T7. Now we're going to treat the facets on the right side from T4 to T7. Yeah, it's really warm in here.
Nikki, can you check the tempo again? What? The tempo you put.
Yeah.
You put a 64, correct? Yes. All right. Going down or what?
No, not yet.
Right click, right? Right click.
Any questions from our audience?
At this moment, no current questions.
Shot. I'm going to move on to his right side. So let's see, 1, 2, 3, 4. Shot. That looks good right there. We're going to numb up the skin. We'll make a 4mm incision. All of this entire procedure is done with a 4mm incision. Let me come off then. 4mm skin incision. That's all it takes. That's why it's a Band-Aid incision, and you get to go home right after the procedure because there's no trauma internally. So there's no need for hospitalization, no need for narcotic painkillers as a result of the surgery itself. How many people have had spine surgery and they had to take opioid painkillers like Percocets afterwards because they're in so much pain? The reason is the surgeon has basically gone inside you and cut your muscles and ligaments and tendons, just chopped them up. And because of that, you're going to have pain, Sean. So by doing less invasive treatment, Sean, you can avoid all that soft tissue trauma that comes with invasive spine surgery. And when you avoid the soft tissue trauma, you actually recover faster without the need of narcotics. Shot? When I say shot, what I'm asking is for my technician to take an x-ray picture. Shot? And using that x-ray picture, I can move my surgical instrument to the right spot in order to destroy the pain nerve that is causing the pain in the patient's facet joints. Any questions?
At this moment, no current questions.
What's going on, Luis?
Yeah, the computer says that it's going down, so it's going down.
Sean? What was the problem? We just forget
we
to...
keep it 66, 60, yeah. And
Sean?
I believe because the temp outside, the room, yeah, the room, maybe turn on the heater a little bit to control the temp, and then that's why.
I don't know, it doesn't sound right to me. Sounds like there's possibly an issue with the machine. You don't think so?
Last night? No.
Or a human error. That I believe. Forgetting to set the temp. Maybe having it on a program. Either way, let's get it fixed. Henry, any questions?
Yes, we just got a question from Ab Diaz on YouTube.
Sure.
Asking, how do you diagnose that this patient has facet pain in the thoracic region?
That's a great question. So the answer is it's a clinical diagnosis, which means that I look at the physical exam of the patient. I examine the patient physically. I inspect where their pain is coming from. I palpate their spine. I use their MRI scan that they have. So they have an MRI scan. I look at the discs, see if there's a herniated disc on the MRI. That can usually give you a clue. And if I don't see a herniation, well, and the pain is to the side of the spine, like his, then I know it's the facets. And if you want to confirm that, you can do what's called a medial branch block, where you can numb up the facet joints with Novocaine using the X-ray machine. And if that takes the pain away, you've just confirmed the diagnosis. But that's an extra procedure. You have to take the patient to the operating room. You have to use the X-ray machine again. There's additional cost, additional risk. So what I've done over the years, I've got very good at diagnosing facet joint pain. And he had pain along the side of his spine from here to here on both sides. So we just went in and destroyed the pain nerves. Our incision for the Deuk plasma rhizotomy is 4 millimeters. Now we're going to do his cervical spine. He has 2 herniated discs. We're going to be back shortly for the Deuk laser disc repair to repair 2 herniated discs in his neck. Any other questions?
No current questions.
All right, thanks, Henry. We'll be back shortly with our next live stream for cervical disc surgery, C5-6, T6-7. Hey, good morning. March 6, 2024. I'm Dr. Deukmedjian. I'm here at Deuk Spine Institute with one of my patients who traveled here for a thoracic disc problem. I'm going to let her tell you a little bit more about how life was before her surgery. Thoracic disc herniations and pain, they're not as common as lumbar and cervical, but when they do happen, they can rob people of their quality of life. What was your life like before you had your surgery yesterday?
Oh, miserable. I spent over 5 years being in 24-hour pain. Just pain. Couldn't go anywhere. 95% of my time is at home, in the house. Before then, I would dance, have fun, work out. But now, pretty much, I'm a prisoner in my own house, in my own body.
And where was your pain?
Right at T3-T4, burning, aching, 24 hours a day, no sleep, nothing. Just sitting in the house all day, not living my life at all.
And yesterday we went in endoscopically. We found that T3-4. We used the laser to clean out your disc and get rid of the herniation and the tear. How do you feel today?
Oh, I feel fantastic. I feel like a new person. I feel like I got a new beginning, a new chance at life. Thank God for you.
You know, the burning, it's common for people to have muscle pain after the surgery. We can't fix muscle pain. We fix joint pain, but we can't fix muscle. And unfortunately, when you have joint pain, like you did, the disc pain, it's a deep knife aching pain, and it keeps you from doing things like you said. You were robbed of dancing and doing all the activities you normally do. So the muscles get deconditioned. They start to get weak. It takes time to rebuild them. And that's one of the things we can't do as surgeons. We can't rebuild your muscles. The patients have to. And so now you're going to go out and be active?
Absolutely.
You're going to start dancing again?
Absolutely.
And who are you going to think about when you're dancing?
You?
Dr. Deuk and Deuk Spine.
I'm gonna make up a Deuk line dance. How about that?
Oh, I love it. Promise me you're going to post that on YouTube so we can see it.
I have a YouTube channel. You got to come on my YouTube channel.
I would be happy to come on your YouTube channel.
Sure.
You have my cell phone number. Text me. Let me know what you want me to do. I would love to do whatever you need me to do on your YouTube channel. It would be an honor.
And I want to say one other thing.
Yes, ma'am.
If you're in pain, don't ever give up. Our research countless
Amen.
nights. Don't believe what the first doctor say. I had doctors who tell me, just be this way the rest of your life. I refused to give up. I said, no, you just practicing medicine. I'm new into somebody else. So don't give up. Don't believe the first doctor, the second, third, fourth, or fifth. I've seen over 20 doctors to be exact. So don't give up. Do your research and come to this man, Deuk Spine Institute in Melbourne, Florida. don't give up.
We've been very blessed here at Deuk Spine for several reasons. God has given us the ability to understand where pain comes from, but also how to get rid of it
Absolutely.
properly and safely.
Absolutely.
And that's what we did yesterday. We went in with the endoscope and we found the tear and we used the laser. We did it all with a 4mm incision. You can almost not see it on her back. I had to look for it.
Right.
But it was right next to that giant incision
Yes.
that they did. Some doctor tried to cut her muscle out of her spine
Yeah,
to
he
get
did a
rid of her
trigger
pain.
point excision is what they call it. Yeah.
That was a first for me in 26 years of practicing spine surgery. Never seen that. Cut the muscle out. But that's not the right thing, folks. Muscles are not the main source of pain. It is the joints, and the muscles are secondary. So fix the joint problem underneath, and the muscle pain will eventually go away. Congratulations. Is there anything else you want to say to your people out there, your YouTubers, your followers?
Absolutely. Just stay tuned. The party is going to happen. The party is going to happen. And one other thing, you said this was the first time you ever seen this. You're the first doctor I ever seen do what you do.
Thank you.
So we're 1-1.
There we go.
Hey. Thank you so much, Dr.
You're
Deuk.
welcome. Safe travels,
Thank you.
sweetheart.